We visit the Emmanuel Eye Centre in Accra, Ghana. This facility specialises in eye care, offering optometry services to an average of 120 patients a day. Although it is a non-profit organisation, it's run like a business in order to optimise the benefits.
This is the general outpatient where people would, their patients with their relative come and sit. They wait in the morning, take their numbers, and then they are called in to the main clinic for consultation in tens, 10, 20 at a time. So what you see here is a waiting area. We also do worship and devotion here. We also pray with the patient, do counseling, and also health education, especially about eye conditions and factors affecting disease.
Not all the patients are able to pay for their treatments. By offering extra services to patients who can afford them, the clinic is in a position to even out the financial differences. In recent months, the number of patients has increased enormously.
Yes, there's been a dramatic increase, especially with the introduction of the National Health Insurance. Our numbers have been going up because formerly we have only one system. We call it cash and carry. If you come in, you pay, and then you pay for everything. But with the introduction of health insurance, people pay a premium. The only problem we have is the delay in payments. Like those people who come today with health insurance, it will take about 3 months before we get our reimbursement. So that is a big problem. This, we have the stock. This is empty. This is empty.
This problem is evident in the stockroom. This is where the business element of running the clinic comes into effect.
So basically it's due to either the supplier hasn't got the stock from outside, or he has a stock but we haven't made the previous payment. If you don't make the previous payment due to one reason or the other, they also don't supply. And that's where the problem comes. In terms of medical supplies, patients come in and they need the medication immediately. So we have to stock and then supply. But the financial problem in terms of investment is when you stock, is on credit from the suppliers, and you need to repay to restock, and the insurance and some of the services delay. So we have to go for bank loan, which is very expensive, around 28-32%. So most of the stock depends on the cash flow. Sometimes some are virtually low or nil, like here we don't have any. It's supposed to be in supply, but due to the problem of supply, demand, cash flow, then there's shortage. So running a clinic is a real business. You've got to get a team together, the administrators, the accountants, the bankers, and then the medical team. And you keep going. So you always have to keep an eye on each and juggle. Hello, Rita. How are you? How's the day's work?
The clinic has implemented effective ways of offering specialized services. An example of this is the outsourcing of the laboratory. This allows the clinic to cater for patients without having to fulfill additional management functions.
Laboratory requires special technology, special techniques and experts which are trained. And in order not to overburden the hospital administration doing all this, we are a small eye clinic in terms of service provision. So we bring them in to help us and relieve us of that management burden. From business point of view, it's a synergy in terms of boosting our business here and also boosting their business. That is, we partner. We really provide the clients for them, and they provide the technology and the staff.
The eye clinic is operational from the early morning until late evening. Tending to the needs of over 100 people a day requires the highest levels of efficiency.
So it's sort of a cycle. They come in, go through the process, go in for consultation. As you see, somebody is walking out, come in, and then they'll go either to pay or to get their medication, and then they go home. And they continue sometimes up to 6 p.m., depending on the volume. On the average, 120, sometimes going to 180. Sometimes some people have to reschedule to come the following day. So that's how it goes, and everybody gets served one way or the other. Looking at what goes into being an entrepreneur, I feel like I am, because being trained a doctor and then running a separate non-for-profit hospital it calls for vision, calls for management, calls for administration, it calls for financial analysis, and also putting the whole thing together and then stepping back to keep it running with the team, from the staff to the patients to the place. That is what it takes to be an entrepreneur.